to the videos what I have been taking up in pharmacology. So in the playlist of pharmacology, another video for all the students of MBBS, BDS, nursing pharmacology. Another very important short note question what has been very frequently asked in your professional exams is about the placebo. So in placebo, whenever you are asked to write a short note about, so in the short note, what you are supposed to write, how much you are supposed to write, in this video, we will be summarizing in a very short form, in a very gist, that what is placebo and what are the uses of placebo, in what all patients it is being given, and what are the factors what are affecting the placebo. So students and viewers, beginning with placebo. The word placebo is derived from the Latin word which means I shall please or I will please. This literally means that in pharmacology, a placebo is a drug which is not having any pharmacological effects. So it can be also sometimes called, referred to as a dummy medicine. So a dummy medicine which is having no pharmacological effects is called as placebo, and the substances what are being very frequently used by the healthcare professionals, the doctors. So in placebo, whenever a doctor prescribes a medicine, it is basically he's giving the medicine in the form of starch, in the form of lactose. So these are the substances what are given to certain patients just in the form of tablets or pills, or they can be infused intravenously just to make the patient believe that he is getting healed or he is taking medication for that particular cause. So the word placebo itself is meaning that in Latin it was meaning that I shall please or I will please. So such patients who are anxious, who are having anxiety, depression, or any kind of a behavioral or emotional issues, so in such patients the doctors mostly prescribe certain placebos, and which has found to be having very beneficial effects in patients. So students, beginning with, whenever we look at the uses, so what are the uses what are associated, what can be seen in what all cases doctors prescribe placebo. So very importantly, they are used to relieve the symptoms like anxiety, headache, tremors, pain, and insomnia. So there are certain patients, out of no reason they are feeling anxiety, they are feeling depression, or there are certain patients who are having lack of sleep. So lack of sleep means they are having sleepless nights. So the anxiety is there, the tremor is there, the pain is of unknown origin, the anxiety is of unknown origin. So in such cases, doctors, when they meet doctors are prescribing them placebos just in order to soothe down or to give them the mental state that they are taking medications for that particular cause, whether it be anxiety, depression, tremors, pain, insomnia. And apart from this, the next important use of a placebo is they are used in clinical trials. In clinical trials means whenever a drug needs to be tested or a medicine is launched into the market, before it undergoes several trials. So these placebos, they are also used in clinical trials to minimize the risk of bias. So any kind of an error. So one group will be given up if a new drug, for example, if a new drug is being administered in the market, if it is to be launched in the market. So that new drug what is being launched into the market, firstly, it has to undergo certain clinical trials. In certain populations, in certain group of people, that particular medication will be given. Apart from this, this is the case group. Now, the next group, in which the control group, where certain patients who are not given that particular drug and they are given placebo on that note. So just to minimize the risk of errors and to make the trial in clinical trials of certain some certain pharmaceutical companies, or in certain clinical trials of certain medicines, these placebos are being used to minimize the risk of any kind of a bias or error. Now, moving on to the next important heading, that factors what are affecting placebo effects. So very important, what are the factors what are going to affect the placebo? So whenever any patient is taking any placebo for any reason, firstly there are so many factors what needs to be considered. Firstly, it is the patient factors. So very importantly, what patients are being given placebos are being given to such patients, mostly the neurotic patients. So the patients who are exhibiting the symptoms of neurotics such as anxiety, depression, emotional disturbances, So such emotional and behavioral issues, the patients who are suffering from these neurotic, in order to deal with these neurotic symptoms, these patients are given placebos, and the patients with neurotic symptoms, they respond well to placebos as well. It has been found. The next important factor in giving placebo, it is the drug factors. So very important, the placebo can be affected by the presentation by which route it is being given. So there are certain placebos what doctors prescribe either in the form of tablets or pills, or they can even be infused through intravenous route. So intravenous route of drug administration can be given for certain placebos. For example, colorful tablets such as red, blue or green and injectable preparations give a better placebo presentation. So very important, give a better placebo preparation. So certain patients, they can even need the drugs in the form of tablets or pills of different colors, and apart from these placebos can also be given in the form of injectable preparations. Now the last and the third, the most very important factor in case of a placebo consideration is about the doctor factors. So you must have seen, students, very many times, it is sometimes the impressive personality of the doctor. So if a doctor, the personality of the doctor, the motivation of the doctor, so there are certain doctors who are very pleasing, and if in certain cases the patient is exhibiting the symptoms of tremors, pain, insomnia, anxiety, depression, and the cause is evidently unknown. So in certain cases it has been found that if that certain patient is meeting with a doctor who is having an impressive personality, so that impressive personality has a greater effect in the placebo drugs. So the motivation given by the doctor, the impressive personality of the doctor, the which doctor is prescribing that placebo, what kind of a personality that doctor holds, and how the patient counseling is being done, how the patient motivation is being done by that doctor who is prescribing placebo is another very important factor which is going to affect the placebo action, how the placebo is working. So the personality of the doctor, the motivation given by the doctor, the process of instruction, how the doctor is instructing the patient to take that placebo drug. Apart from this, how the doctor patient relationship is there. So the relationship of the doctor with the patient who is prescribing this placebo are important factors that affect the response to placebo. So students and viewers, this was a very short discussion where I have discussed in simpler terms that what is a placebo, what are the uses of placebos, in what all patients it has been given, and what are the factors that are going to affect the placebo effect. What are the factors affecting the placebo effect? So students and viewers, if you like this video, give this video a thumbs up, and if you are new to my channel who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. And those students who are new to my channel, subscribe, and if you like this video, give this video a thumbs up, and don't forget to share amongst your friends. If there are certain topics what you want from me in English, you are most welcome to comment me in the comment section. I have uploaded the same video of placebo in pharmacology in Hindi, so you can see the previous video of mine on YouTube and stay connected. If there are certain topics, if you want it from me in English or in Hindi language, you are most welcome to comment me in the comment section. So students, thank you for watching.